High-powered MRI scans may pose a potential poisoning risk to people with silver dental fillings, warns new research. The study shows that ultra-high-strength 7 Tesla MRI scanners may release toxic mercury from amalgam fillings in teeth. The scanners rely on strong magnets to work, and researchers suggest the magnets could break down amalgam fillings, metal-looking fillings in hundreds of millions of people around the world. Amalgam, which has been commonly used in dentistry for over 150 years, is 50% mercury, a highly toxic heavy metal. A lab study showed unsafe levels of mercury were found in saliva after a tooth with a filling was scanned by a 7T machine, which is more than 4 times as powerful as a normal hospital scanner. It is not clear whether there would be enough to cause mercury poisoning, but if it did, severe cases can increase the risk of brain damage, heart attacks, or infertility. The researchers said the effects of the stronger MRI on fillings had not been studied, but they found it could be a risk to people with filled teeth. The same effect is not seen in the lower strength, 1.5 Tesla MRI scanners, which are commonly used in hospitals. For now, the powerful 7T machines are used primarily for research, and there are only a handful in the country. St. Thomas Hospital in London and the universities of Glasgow, Cardiff and Nottingham are among those which have the machines. The machines, which were approved for use in 2017, create clearer images for medics to study but may carry a risk if used in practice, scientists claim. Fillings seal mercury inside when they are in the tooth. Researchers at Akdeniz University in Turkey explain that when an amalgam filling hardens, the mercury is sealed inside it and a protective film layer covers the filling's surface. The study's lead author, Dr. Selmi Yilmaz, a dentist and faculty member at Akdeniz University, said, in a completely hardened amalgam, approximately 48 hours after placing on teeth, mercury becomes attached to the chemical structure, and the surface of the filling is covered with an oxide film layer. Therefore, any mercury leakage is minimal. However, they say the magnets in the stronger scanners, nearly 5 times as powerful as a normal hospital scanner, cause corrosion in the amalgam, which allows toxic mercury to leak out. Mercury poisoning can cause brain damage. High levels of mercury in the blood can cause brain damage such as paralysis or slow reflexes, may increase the risk of heart attack or heart disease, and can reduce men's sperm counts or increase the risk of a woman having a deformed baby. In our study we found very high values of mercury after ultra-high field MRI, Dr. Yilmaz continued. This is possibly caused by phase change in amalgam material, or by formation of microcircuits, which leads to electrochemical corrosion, induced by the magnetic field. Based on Environmental Protection Agency standards, the amount of mercury released would far exceed levels considered safe for people. Dr. Yilmaz added, although it is not clear how much of this released mercury form is absorbed by the body, the study findings indicate that amalgam fillings may pose a risk not only to patients, but to staff too. How the research was carried out. Dr. Yilmaz and colleagues evaluated mercury released from dental amalgam after 7T and 1.5T MRI in teeth that had been extracted from patients for clinical indications. The researchers applied amalgam fillings to a number of extracted human teeth with cavities. After 9 days, 2 groups of 20 randomly selected teeth were placed in a solution of artificial saliva, then put in either a 1.5T or 7T MRI scanner for 20 minutes. Another group of teeth was placed in artificial saliva only. When the scientists analyzed saliva afterwards, mercury levels in the 7T group were around 4 times the levels found in the 1.5T group and the saliva-only group. Patients should not worry about MRIs in hospitals. As no evidence of harmful effects was found in the 1.5T group, the researchers said patients with amalgam fillings should not be concerned about having an MRI exam. The researchers said further studies may be needed to confirm the relationship between high-field MRI and the release of mercury from dental amalgam. The team has 3 ongoing projects focused on the effects of magnetic fields on amalgam fillings. The findings were published in the journal Radiology.